Okay, welcome to OET for you. Okay, today we are going to discuss about the case note Nina Sharman. And as you know, your OET writing have 45 minutes and 5 minutes reading time and 40 minutes of writing time. Okay, so as soon as you got the case note, what you're going to do is you read the notes for that and understand what it is given in the case note. You got 5 minutes to do that. So for that, you have to read first of all about the what is the writing task assigned to you. Okay, so here the writing task is given. You are a registered nurse at the dementia specific unit. Using the information in the case note, write a letter to dietitian at Department of Nutrition and Dietetics, Spirit Hospital, Prayer Town, New South Wales 2175. In your letter, explain relevant social and medical histories and request the dietitian to visit and assess Ms. Sherman's swallowing function and nutrition status urgently due to a high risk of aspiration. So, there are a few things we can get it from the case note. That is, what kind of letter you're going to write. Okay, so it is going to be a referral letter and to whom you're writing and address of that person, and is it an urgent letter or not, is it a non case or not, and in this case that is not. Okay, and actual purpose of the letter. So here referral letter to dietitian, for what purpose? To request the dietitian to visit the care home because you are in a dementia specific unit. Okay, and assess Miss Sherman's swallowing function. Okay, that is the primary function, primary purpose of this letter. Okay, so these are the few things you got it from the letter. So then you go back to the entire case note and find out what are the important things that you can find about this case note, and how you can correlate all the informations for your letter. Okay, so patient details is given, name is given, date of birth, and new resident of dementia specific unit, and west side aged care facility. Okay, so the patient is single and under the Australian guardianship and administration council protection. Medical history is given. Patient got ischemic heart disease since 2005, and she is on nitroglycerin patch daily, and stroke on May 2011. After stroke, unsteady gait. Okay, in 2011, diagnosed with severe dementia, able to understand simple instructions only, confused and disoriented. Diabetes mellitus type 2 since 2000, on a diabetic diet. Osteoarthritis of both knees, 20 years. Voltaren gel to both knees, BD. Weight gain 10 kilogram over the last 5 months. Current weight is 106, that BMI of 30. Chronic constipation, takes laxatives PRN. No allergies to medication or food. No teeth, has entire upper or lower dentures. Sometimes refuses to wear dentures due to confusion and disorientation. Increased appetite, usually eats full portion of offered meals in 3 times daily, and also goes into other residents' room and eats their food as bananas, biscuits, or lollies. Okay, social history is given, no friends, lack of interest, but likes coloring and watching television. Increased emotional dependence on nursing staff, non smoker, no use of alcohol or illegal drugs. Recent nursing notes: 15th February 2012, chest infection, Keflex 500 milligram QID into 7 days. And 26th February 2012, after few days, okay, 10 days, occasional cough and episodes of shortness of breath with increased respiratory rate. And 27th of February, the next day, sporadic throat clearing after eating yogurt. Okay, so 20th of March 2012, on 15 hours, episodes of choking on a piece of food not chewed properly, and she suddenly turned blue, grabbed the throat with both hands and coughed. The piece of solid food was removed, and at 17:10 hours, nursing assessment after treatment. pulse was 110 bpm, and BP was 120/70 mmHg. Respiratory rate is 22 per minute. Temperature is 37.1, and PSL is 0.6 mmol per liter. 18 hours, no compliance. Pulse rate is okay. BP is 115 per 70 mmHg, and respiratory rate is 16 per minute. Temperature is 37. Skin color is normal now. Hospital visit not required. So these are the informations given in the case note. So you have to identify your task, which is clearly given that you are writing to a dietitian. So pick up the relevant notes for a dietitian to says relevant social. Explain in your letter social and medical histories. So we need to write social histories as well as medical histories along with a request for assessing Mr. Man's swallowing function and nutritional status. And it is an urgent letter that we didn't mention in the primary talking, that so this is an urgent letter. Okay, so the urgency of the letter needs to be clearly mentioned in the introduction. Okay, so what are the important or relevant case note in this case note? We have a look. Okay, so social and medical information needs to be explained, histories needs to be explained, and the reason for writing the letter is also needs to be explained. How you're going to writing the letter depends on how you're going to planning your letter. Okay, so the introduction should be then the first body paragraph should be about uh, the organization part. That should be about what is the reason for writing this letter. Okay, because of the immediate urgent need for a uh, swallowing yeah, swallowing function. Yeah, swallowing function. And what we need to tell is that that reason is actually he had an episode of choking, and that history you needs to be said in the first paragraph, and the correlated informations as well. So all of the informations given in these few things is important, because this is very much important information you're going to talk in the first body paragraph, and which is, and you can explain that at the present condition of the patient, that is hospital visit was not required at that moment, and patient went back to the normal status. Yeah, so that also you can mention in that first paragraph. And again, the previous 2 days infection history also you can describe in the same paragraph, because which is a coughing and episodes of shortness of breath, which is also related to chest infection. Most probably this is also related to some swallowing difficulties, swallowing problems the patient had earlier. Okay, so these are the important informations you can write in the first paragraph. When it comes to the next paragraph, you can mention all the important medical histories, like ischemic heart disease, stroke, and diabetes mellitus. Okay, osteoarthritis. Okay, so chronic constipation and BMI. Okay, and uh, that you can mention in that one. Yeah, so then when it comes to the social history, you can talk about lack of interest. Okay, so and again, under the Australian Guardianship and Administration Council Protection Program. Okay, so about her daily living things, like the dentures and all that things you can mention, and confusion and disorientation you can also mention about the when you're mentioning about dementia in the second body paragraph. Okay, so now we are going to see what's in your letter. Okay, okay, letter 6, the letter for dietitian, and the dietitian Department of Nutritional and Dietetics, Spirit Hospital, Prayer Town, New South Wales 2175. And 20th of March 2012, dear Sir or Madam, regarding Miss Nina Sharma, date of birth is given. I'm writing to request an urgent visit to assess Miss Sherman's swallowing function and nutritional status as she is at high risk of aspiration. Okay, so she is at high risk of aspiration, not in. Okay, so that you needs to be correct, at high risk of aspiration. Okay, so other than that, the introduction seems to be okay. Like you are writing for an writing to request an urgent visit to assess Miss Sherman's following function and nutritional status. Okay, so you are saying it is a reference letter. You don't need to mention it in that, so but it's okay regarding that. Okay, so I'm writing to request an urgent visit to assess Ms. Sherman's swallowing function and nutritional status. And again, since she is at high risk of aspiration, is better than as. Okay, that is another thing. You can change that as in your letter if you need to be, because that we already discussed in the previous classes. Okay, so today Miss Sherman has an episode of choking on a piece of food due to improper chewing, and she turned blue and her food was removed and she became normal. So we already explained while we are discussing about the case note what we are going to discuss in the first paragraph. Okay, so in that case, so you have to go back to the case note and your idea is okay. That means we decided to talk about the immediate incident of that patient needs to be a little bit more detailed. So what we are going to say is, okay, like patient on that day, 20 of March 2012, that was when you are writing the letter. You are writing the letter is on 21st, that means yesterday. Okay, so you can say day before you can say on that date, yeah, on 20th March 2012, at that hours she had an episode of piece of food. Okay, episode of choking with, yeah, so as you mentioned, so you can go with that episode of choking with the unchewed food material, and she grabbed her throat with both hands and cuffed, and she turned into blue. And pieces of solid food was removed, and there is no complications, and all vitals were came to normal within 1 hour. Okay, so there is no hospitalization done, and skin color back to normal. So that you needs to be says in that paragraph. Okay, so what you have written. So today, okay, it's not today once upon, because you are writing on 21st. The date should be wrong here, so it should be on 21st. You can see the case note letter, because this is on uh, you know evening time, 17:30 or 17 means 5 o'clock, 5 p.m. evening. Okay, that time it is happened on 20th, so it should be on that date, needs to be correct. While you are reading your case note, you should be very careful regarding that. Miss Sherman has an episode of, okay, yeah, because it was happened yesterday, it should be in past. It should be Miss Sherman had an episode of choking, okay, on a piece of food. You can say unchewed food materials, or uh, choking due to an improper chewing food. Yeah, so write it in a single word uh, rather than okay, so rather than writing in a separate word. Okay, so and she turned to blue. Yep, her foot was removed and she became normal. So mention that her Okay, sorry for that. But okay, so today Miss Sherman had an episode of choking on a piece of food due to improper. Okay, improper. So improper chewing. That's not a correct usage of verb. Okay, so what we can say that we can say the word already mentioned in the case note is they said that improper or chewed not properly. So you can say okay, unchewed food material. Yeah, so you can say unchewed food material was found on his mouth. Okay, so you can say on 20th, the sentence should be like this: on 20th of March 2012 at 17 hours, Miss Sherman had an episode of choking with unchewed portion of food. Okay, and she suddenly grabbed her throat with both hands and cuffed, and she turned into blue. And the pieces of food was later removed, and her vitals back to normal. And currently, she is settled. Okay, so there was no hospitalization uh, no hospitalization done, and her all vitals came back to normal. So you have to mention clearly instead of saying she is normal. Okay, so it's not about the normal, so it became all the vitals becomes normal. Need to mention that instead of that. Okay, so that we already said that. So what, how we going to say that? So all right, here we write on 20th of March 2012 at 17 hours, measurement had an episode of choking due to unchewed chewed unchewed piece of food material which is removed removed later, which was removed later, sorry, which was unchewed to an unchewed piece of food materials which was removed later. So that sentence is the okay. So you can say was she was turned to blue and cuff cuffed at that time, and her turned blue. Okay, she turned blue and cuffed at that time, and her vitals her vitals and skin color back to normal after 1 hour. Okay, okay, so that would be fine. Okay, that's about that. And she had a recent in addition Okay, you don't need to mention about the A infection in this one. Okay, color went back to normal. Okay, good. This is the sentence you can write instead of what you are written in the first paragraph. Okay, so moving forward to the next paragraph, Miss Herman has had diagnosed with dementia since 2011 and is able to understand simple instructions only. Moreover, she is confused and disoriented and refuses to wear her dentures due to her mental conditions. That would be sufficient enough to do that. That's about only one disease there. Then she has got Miss Sherman has had stroke, ischemic heart disease, diabetic mellitus since 2011, 2005, 2000 respectively, and she is on diabetic diet. She has increased appetite and usually eats full portion of food meals 3 times daily. Additionally, she goes to other residents' room and eats the food too. She gained 10 kilogram more for the past 5 months, and her current BMI is 30. She has got chronic constipation and is on laxative when required. That is absolutely fine when you are writing about the medical condition and her social things. Okay, so the social thing, Miss Sherman is a new resident of our care, and she is single and has no friends, and she emotionally on depends dependent on nursing staff. On nursing staff. Okay, that would be fine. Okay, dependent on nursing staff. That's she is emotionally dependent on nursing staff. That would be sufficient enough. Okay, it would be beneficial if you could assess her immediately and do the needful. Yeah, that's fine because the body paragraph is says about the function, and you can also mention about the the she's under that Australian government program for the protection and things, because then that may be an additional thing you can say, because is the dietitian also want to know whether she's got any other caring provider or something like that. That would be nicer. Okay, so that's all. This letter doesn't like it's appropriate absolutely. A little bit corrections, but more than that it's absolutely fine. Okay. Oh, good. So thank you for watching this